I would now like to extend a warm welcome to Professor Lesley Anderson and to Dr. Lynne Lohfeld, who are going to talk to us about the impact of COVID on MPN patients and tell us what we've learned. Welcome.
Hello and welcome. I am Professor Lesley Anderson. I am a Chair in Health Data Science at the University of Aberdeen, and I'm here with my colleague Dr. Lynne Lohfeld, who is a lecturer in Global Health at Queen's University Belfast. I have undertaken a lot of research in myeloproliferative neoplasms over the years, trying to understand what causes MPNs. And at the start of the pandemic was particularly interested to understand what impact this had had on patients with MPNs. We started a study with the aim to identify the psychosocial, how people feel about the pandemic, and also understanding the impact that this has had on healthcare and treatment for patients. We advertised the study across a number of platforms, including through charities such as MPN Voice, Blood Cancer UK, Macmillan and Leukemia and Lymphoma NI. We also worked through the MPN Advocates Network in the United States and advertised on a number of Facebook groups and through Facebook advertising. We also tweeted about the study across multiple sites and had radio interviews and press releases in local newspapers in Scotland. The study targeted patients internationally, but particularly within the United Kingdom. Patients were asked to complete a number of different questionnaires looking at characteristics about the patients, such as their gender and their age, and also asked about their quality of life and the impact that the pandemic had on their quality of life and their MPN symptoms. We used the MPN SAF questionnaire, which many of you might be familiar with from your treatments and also from clinical trials that you may have participated in. And this is a questionnaire that's dedicated particularly to patients with MPNs and asks about a whole array of symptoms. And I'll show you some of the findings in relation to that survey later on. The other thing that we wanted to find out about was around COVID-19. So who had been exposed to COVID-19, who may have suspected that they had had COVID-19, and also what impact this had on their treatments and on their scheduled appointments. In total, we recruited 537 MPN patients by the end of June 2020, although the study is still open. There were 67% of participants were from the UK. The majority were female, and there were a significant portion of people who lived alone, where the pandemic may have had further impacts in relation to isolation. A large majority of the patients were retired, either medically retired or retired through older age. And there were a number of different types of MPN patients who had participated in the survey. The majority of patients had essential thrombocythemia, but we also had 150 patients with polycythemia vera, and we had 69 patients with primary myelofibrosis. About a quarter of patients stated that they were moderately or extremely anxious or depressed at the time of undertaking the study. Apologies. MPN symptoms were recorded by participants, and this graph, which is called a radar plot, shows how common symptoms were, how extreme symptoms were in patients with MPNs. We have patients, and the red line depicts those who participated in this current survey. There are two other lines further in the radar plot, and these show two previous studies, one that was a UK case control study of MPN patients and one which was an international survey led from America. These two prior studies showed that the symptoms were expressed and experienced very similarly between MPN patients, but the current survey has shown that many of the symptoms experienced by MPN patients are much worse than previously reported. We're seeing particularly that fatigue is a very significant problem, and the further out in the radar chart means the worse the symptom is. So we can see that fatigue, general activity, mood, walking, which is difficult during the pandemic because many participants were screening, and relationships with other peoples, as well as some of the other symptoms such as dizziness, concentration and headaches. And so we identified not only that these symptoms were more common and worse in patients with MPN during the pandemic, but we also identified that quality of life was also lower than general population norms. So that's what we would normally expect to find in people in the general public. We also find that 13% of patients suspected that they had COVID-19. Only one patient reported having had a confirmed diagnosis. About 5% of patients had been in contact with somebody who had tested positive for COVID-19. And in the United Kingdom, about 80% of patients were self-isolating, and that 72% had received a shielding letter. And many of you have received one as well. We had about 2/3 of patients who were going outside for physical activity. This may have been outside in their own home environment. 63% were very or extremely concerned about contracting COVID-19, and 57% said that it had had a negative impact on their health. I'm going to pass over now to my colleague, Dr. Lynne Lohfeld, who will present some of the findings from the open text response questions that we had. Thank you.
Thank you, Leslie. As Leslie mentioned, I'm Lynne Lohfeld, and I am here to give you our preliminary analysis, or what we found from the answers people wrote in to the questionnaires or the open-ended questions. And on the screen as well, as Leslie had mentioned, the survey is still ongoing, and so this is the website where people can reach the survey. What we did is something called qualitative content analysis, and that's just a fancy term meaning for each statement that people wrote, we gave it a label or a code, and then we looked at all those labels and clustered them into categories, and finally reduced them even further to, in this case, 2 themes, which I will talk about, and it helps us organize the data because there was a lot of information. So the question that we are focusing on today was, what concerns do you have about the impact of COVID-19 on the care you received as a cancer patient? We found that 115 people decided not to answer that question. So 422 people, which is still a large number, gave an answer. Many of them, though, wrote no concern. So finally, we had 284 people who gave 329 answers. Some people gave more than one answer, of course. And the 2 themes, the first is the healthcare system changes due to COVID-19. And the second were COVID-related concerns that individuals had. So for the first theme, we found that over half the answers, people were saying that things related to their health, such as appointments, were less available or they had less access to them. This included regular monitoring of their blood tests. And you can see we have a couple of actual quotes from our participants. One person wrote, "Will I be able to have my routine blood tests in a few months' time?" Some people were concerned that their treatments were not going to be available on schedule, such as delaying venesections, or access to medication, particularly if they were concerned about going to a GP's office or hospital or clinic to get their medication. We also found from the survey where people gave a specific answer or closed answer that almost half of the people reported they had an appointment changed during this COVID-19 pandemic. And this was 1/3 of all the written in answers, so quite a few people wrote about that. Key concerns were there was delay or cancellation of medical appointments. Some of them still don't know when they're going to next see a practitioner. Many of them also commented on how no longer having face-to-face or in-person appointments or difficulties with phones were a concern. People were not as pleased with that because there are certain things that couldn't be done, such as palpation or things that you would need to do in person with your practitioner. And also, one person commented that being deaf, her hearing aids, or his, were not 100% accurate for clarity of speech. So there was some difficulty for some patients in trying to share or hear about medical information over the phone. A little over 10% reported they were concerned about the lack of information, communication, or knowledge from practitioners or others. It was about things such as the COVID-19 situation. And as one person noted, when nobody corresponds with you, the impact of the virus is greater than it should be. They were also concerned that the doctors would be able to distinguish between their own health symptoms with their disease as MPN patients or related to COVID-19. And there were also some concerns that certain people had received shielding letters where others had not, and it seemed to be at random. The second theme was about people's concerns regarding exposure to or the risk of contracting COVID-19. A large group of people answering, their answers fitting this theme, was about this topic. So the risk of exposure to in hospitals, cancer centers, or their GP's office. They wondered, would it be safe to attend their next clinic appointment, going for their regular blood tests, or having them taken at all? A smaller percentage was also concerned about poor outcomes from COVID, because as their condition is rare, they wonder if people will be able to treat them well in terms of recognizing symptoms, or being immune compromised, putting them at greater risk of having a severe outcome if they develop COVID-19. Another 15% of the people who wrote an answer that we fit into this theme were concerned that their condition might be worsening because they were not receiving regular monitoring tests or due to isolation. One person wrote, "I'm worried my bloods are bad." This is another concern that people have with MPN. Our key findings at this point, and we're still continuing with analysis, is that MPN patients are reporting worse symptoms than previous studies had shown. Many MPN patients are shielding or living alone, and they're concerned about how their health has been affected because of this during the pandemic. There is also a lot of uncertainty about how to safely access care, such as regular blood tests to monitor their health. What's next? Well, we will be completing in-depth analysis of all the answers, sorting the difference by males and females, older and younger, living in the UK or elsewhere. We'll provide findings to healthcare professionals and charities. And we're also planning to conduct 2 rounds of follow-up surveys. 75% of the participants who had sent back a survey had agreed to do this either in September or also perhaps in January. And as Dr. Anderson had mentioned before, the survey is still open so people could complete this first survey if they wished. Again, you can see there is the website where people can access the survey. It's on a platform called SurveyMonkey. And we want to acknowledge the research team. The principal or main investigators are Professor Lesley Anderson, who is here today with me, and Dr. Charlene McShane, who is at Queen's University, and Lesley is at the University of Aberdeen. We have collaborators at the University of Aberdeen with a wide range of expertise, and also several collaborators beyond myself at Queen's University in Belfast.
Thank you to both Lesley and to Lynne for all this useful information that's come out of the research that they've done. Thank you so much.